Coronary artery disease is #1 cause of death in the world. Second most common cause is stroke, and third most common cause is COPD, or chronic obstructive pulmonary disease. To put this in perspective, we can imagine that coronary artery disease kills more people than wars and infectious disease together. It's huge number of population. So coronary artery disease accounts 16% total death in the world. Now let's say what is the mechanism of action and what's happening. On the heart we have blood vessels, arteries, and they called coronary arteries. And over time, because of smoking, inflammation, obesity, hypertension, diabetes, sedentary lifestyle, and other chronic inflammations, these blood vessels are damaged. And because of cholesterol, and main factor is here cholesterol plaques are formed, and they are called cholesterol plaque or atherosclerosis. It causes narrow of blood vessels, especially arteries, and blood flow is reduced. Silently, this reduction is tolerable for years. But after several decades, for example 2 decades or sometimes more, this reduction of blood flow is so prominent that it can cause symptoms, and it is called ischemia. And main symptom is chest pain, which is called angina. So when we hear angina means chest pain due to ischemia. If this ischemia continues, and if this narrowing of blood vessel keeps, and there is complete blockage of blood vessel, myocardial infarction occurs. We have 3 main types of coronary artery disease. First is stable angina, and it's most common. Another is unstable angina, and third is myocardial infarction. Stable angina is most common and most benign. It means predictable chest pain during exertion or physical activity or stress. So, for example, if usually old person, for example male 60 years old, and he got stress and he has chest pain, or he walked fast and he got chest pain, it's stable angina. Stable angina usually lasts 5 to 10 minutes, and it's relieved by rest or nitroglycerin. So stable angina is relieved by rest or nitroglycerin. Symptoms of stable angina include shortness of breath, fatigue, especially during physical activity. If such symptoms, shortness of breath, fatigue, chest pain, pressure sensitivity on chest, if such symptoms occur during rest, it's already unstable angina. So stable angina occurs only during physical activity or during stress. Symptoms can also be sweating, nausea, and these symptoms last for several minutes. People describe this chest pain like discomfort, pressure, or heaviness on the chest, often spreading or irradiating to jaw, arms, back, or stomach sometimes. So angina is hallmark of this disease. Angina is chest pain. Now let's say unstable angina. Unstable angina means when blood flow restriction is more heavy compared to stable angina, and it can cause chest pain during rest. If during physical activity there is chest pain, it's stable angina. If pain occurs during rest, it's unstable angina. Unstable angina usually lasts more than 5 minutes, but less than 30 minutes. Unstable angina is reversible. It comes and goes away. It comes and goes away. But if it comes and if it stays, it's myocardial infarction. Myocardial infarction symptoms last than 30 minutes, and usually it's not reversible if immediate treatment will not be provided. So if unstable angina comes and goes itself and it's reversible, myocardial infarction is irreversible without treatment. That's why it's important, and that's why it's emergency condition. Myocardial infarction is emergency condition. So what is symptoms? Symptoms are same in stable angina, unstable angina, and myocardial infarction. It's chest pain, pressure, heaviness, shortness of breath, pain irradiates to arm, pain irradiates to jaw, pain irradiates to back. Same, symptoms are same, but intensity of symptoms are different. In unstable angina, symptoms are more severe compared to stable angina. In case of myocardial infarction, symptoms are heavier than unstable angina. So symptoms intensity are important. And myocardial infarction is when artery is completely blocked, causing damage or death of part of heart muscle. First hour is important and crucial. It is called golden hour for reperfusion. So treatment is important, and first hour is critical during myocardial infarction. And if it's matter treatment and reperfusion, yes, it's matter even within 12 hours. So myocardial infarction, any case, is emergency situation and it needs immediate treatment. Diagnosis, first usually EKG is made, electrocardiogram, stress test, also echocardiogram, but golden standard of diagnosis is coronary angiogram. That's gold standard of diagnosis. And what is treatment? Treatment it depends, of course, and depends on situation, but generally lifestyle modifications like physical activity, heart healthy diet, weight loss, cessation of smoking, medications like aspirin, beta blockers, statins, and nitroglycerins to relieve symptoms. And sometimes angioplasty is important and bypass surgery is needed. It is called revascularization procedures or revascularization surgery, angioplasty or bypass surgery. It is also known as percutaneous coronary intervention, PCI, and it is known also as an angioplasty with stent placement, because stent is placed to reverse blood flow in the artery. That's the idea. And here is important difference also. Stable angina is reversed and relieved by nitroglycerin. Unstable angina and myocardial infarction is not reversed or relieved by nitroglycerin. That's the most important things here, because such small things will help us to differentiate from stable angina, unstable angina, and myocardial infarction. Generally, Coronary artery disease is medical emergency and it requires medical treatment and medical attention as soon as it occurs. No matter we cannot say that it's stable angina and let's wait. It needs medical attention any case, because there is no very clear steps between, for example, stable angina and myocardial infarction, because myocardial infarction can be first symptom of coronary artery disease. That's why coronary artery disease always medical emergency situation. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.